Ethicon. Ethicon, Inc. is a subsidiary of Johnson & Johnson. It was incorporated as a separate company under the Johnson & Johnson umbrella in 1949 to expand and diversify the Johnson & Johnson product line. Ethicon has manufactured surgical sutures and wound closure devices since 1887. After World War II, Ethicon's market share in surgical sutures rose from 15% to 70% worldwide. In the United States, the market share is approximately 80%. Ethicon conducts business in 52 countries. Corporate history. In 1915, George Fahrenheit. Merson opened a facility in Edinburgh for the manufacturing, packaging, and sterilizing of catgut, silk and nylon sutures. Johnson & Johnson acquired Mr. Merson's company in 1947, and this was renamed Ethicon Suture Laboratories. In 1953, this became Ethicon Inc. In 1992, Ethicon was restructured, and Ethicon Endosurgery became a separate corporate entity. In 2008, Ethicon sold its wound management business to One Equity Partners and became Cystagenics Wound Management Limited. In 2009, Ethicon acquired breast implant maker Mentor, and in 2010 it acquired ear, nose and throat technology company Acclarent. In 2016, Ethicon acquired New Wave Medical. In 2013, J&J merged Ethicon Endosurgery back into Ethicon. Physiomesh class action lawsuits. On June 13, 2016, Health Canada issued a recall of Ethicon's Physiomesh flexible composite mesh product used for ventral hernia repair. The product had been on the Canadian market since September 2010, and patients claimed a range of complications following surgery. The proposed Canadian class action, filed June 1, 2017, is seeking court approval for certification as a class action and is expected to proceed in 2019. Gynecare Prolift controversy. There is some controversy around Ethicon's transvaginal meshes used on patients with female genital prolapse. Ethicon's Gynecare Prolift was introduced in March 2005 bypassing FDA review. The company felt its base polypropylene had already been approved and therefore it did not need to reapply for clearance for its Prolift kit. 3 years later, when Ethicon tried to obtain clearance for its Prolift Plus M, the FDA was alerted to the fact that Prolift had been in the market. The agency approved the Prolift and Prolift Plus M with no penalty. Both were cleared through the Food and Drug Administration's 510 clearance process, that is clearance to sell. Ethicon's parent company Johnson & Johnson utilized the FDA 510 clearance method, which allows a product to be sold without official FDA approval if it is based on another already approved product. However, in 2008, the FDA issued a public health notification regarding reports of serious complications associated with transvaginal mesh devices. This escalated in 2011 when the agency received more than 1,000 adverse effect reports from surgical mesh manufacturers. The FDA decided to order Ethicon and other transvaginal mesh manufacturers to cease production until extensive testing and research on each vaginal mesh device was conducted. In June 2012, following the FDA order for additional testing, Johnson & Johnson permanently removed all Prolift products from the market. In one court case reported by Reuters, the plaintiff, Diane Bellew, on whom the product had been implanted in 2009, said she was never warned about how the device could contract and erode, causing pain and scarring.